I am Dr. Aniket Mohite. I am a hematologist, hemato-oncologist and a bone marrow transplant physician at Jahangir Hospital. So, what is bone marrow transplant and who needs it? Bone marrow transplant is a stem cell reserve where or your hematopoietic stem cells, not the whole body stem cells. So, our marrow is a factory from where all the cells, be it hemoglobin producing cells, be it the WBC, platelets, or your infection controlling lymphocytes, are produced as a store or a factory from where they come into the blood. So you have stem cells which have a capacity to form new cells of each type. They can form hemoglobin, they can form WBC, they can form platelets, and lymphocytes, monocytes, macrophages, neutrophils, eosinophils. So the different variety of the cells that help us find or fight infections, help our body oxygenation system, which is the role of hemoglobin, or stop bleeding or help in clotting wherever required, is the role of platelets. So a cell which has a power to completely replenish or change somebody's immune system or the whole cell lines. So it can produce all these cells if we are giving them to a donor, from a donor to a patient. So what are the types of transplant? So whenever you have the stem cells used from the patient itself. So can we use it when the patient is diagnosed? No. In patients with diseases like myelomas, where it is a standard modality of therapy that you give them chemotherapy 2, 3 or 4 cycles, assess that the disease has come back to a bare minimum level, collect the stem cells. So is bone marrow required for collecting a stem cells? No. Current modalities or the current type of transplant which is used worldwide is peripheral blood stem cells. So as simplistic measure like doing a blood donation, now each one of us are well aware about doing a single donor platelet. That is, one donor is subjected to an apheresis machine which circulates the whole blood through the machine, and only a quantity of 100 or 150 ml forms a platelet. So that is what we call a single donor platelet, which is equivalent to around 6 random donor platelets from 6 different donors. A similar concept is used, the apheresis technique is used, where we give the patient injections, that is GCSF, which are used in any patient when the counts go down to help the WBC count come up. This also mobilizes the stem cells from the marrow and brings it into the blood. So whenever the blood is circulated through the system via a central venous catheter, or if they have good veins, it could be just piercing a wide bore needle, and the blood from the patient is circulated in the apheresis machine, and around a 200 or 300 ml volume of bag which has predominant stem cells collected in it would be collected, and the rest of the blood is recirculated back to the patient. So this kind of transplant, where we are using the patient who has malignancy like myelomas or lymphomas, when they have adequate amount of therapy to bring down the disease under control and collect their own stem cells, that is autologous stem cells, to replenish their own body production system after giving high intensity chemotherapy, is what is stem cell transplant. So whether we require bone marrow for each and every patient? No. Now bone marrow is only a source of stem cell transplant. You have peripheral blood stem cells and what we are all now aware in the last decade or so of the cord blood. So these are the 3 various areas from where the stem cell resource can be, either it is a marrow or it is a peripheral blood and it is a cord blood. So how do we select which transplant we do? So majority of the times in the worldwide, peripheral blood stem cell is the predominant modality of autologous stem cell transplant, accounting to around 90% of the transplants, where bone marrow is done only when the patient is too small, like in patients with neuroblastoma or some of the GCTs where they are less than 7 years of age, or their weight is less than 30 kg, where the blood volume is so tiny that if a part of the blood volume is circulating through the tubing system of the apheresis machine, they will go in a hemodynamic compromise. So the first principle is keep the patient or the donor safe. So barring that principle, we go with a bone marrow harvest. So that is, we are collecting the bone marrow from that patient to give it back to them, or from a donor who is less than 7 years of age to give it back to a patient who is having a stem cell transplant.